It's really, really a tricky place for us at the moment. And of course, my area is movement, but also where manual therapy fits into that. Because, of course, we've had this big pendular swing away from the manual therapies.
Yeah.
And this meme has gone across social media that there's no evidence for manual therapy. This isn't actually true. But you never let the truth get in the way of a good meme. It works for Donald Trump. And,
Yeah.
2019, I stood on a stage at a national conference talking about where that evidence actually is. Now, there may be, issues around the explanations we used to have for what we're doing. But there's other explanations coming up.
Yeah, I'm glad you mentioned
like
a date, 2019, because Sam has sent in a question saying, Joanne, do you think some of this is down to a general reduction in confidence after COVID, or was it already happening beforehand? And I know COVID gets blamed for just about everything, but of course it does have some consequences, both physical and psychological, doesn't it?
Absolutely. I mean, the anti-manual therapy discussion goes back probably to 2013, 2014. When that really started to rise. What I would say is that the effect of COVID on the autonomic nervous systems of clinicians is probably driving a lot of things. I mean, as in general, I mean, people are probably finding with their patients, the general level of arousal in people coming to us is different. And we have to recognize that it is the same for us. We are humans after all. And sometimes I think we forget that. And we sometimes feel that we have to be somehow beyond human, and that we're not recognizing that this is changing some of our responses. So there's research that shows that under pressure, what we will do is regress to whatever we know and try and go deeper into that.
Yeah.
And that is a stress response that is observed across multiple disciplines in multiple fields. So it's a human thing.